No, I think that's a really good question. The way we tend to look at it is that, as the point was already made, obviously some people will be asymptomatic and necessarily might not know that they have the virus. Other people will have symptoms and they'll get tested. What we tend to find is that you tend to get this delay where from people getting infected about a week or so, 10 days later, you may start to see, if we see the numbers increases in hospital admissions, and then a couple of weeks later from that, we can see the number of deaths unfortunately increase. So what I would say at the moment, from the data from Suffolk, and apologies, I don't have these figures for Northeast Essex, but in the first wave, we saw unfortunately about 660 deaths above and beyond what we would expect for a normal year. So these are what you might hear in the news being labelled as excess deaths. What we have seen in the most recent data is an increase in those deaths again. So a couple of weeks ago, we saw, I think there was about 50 more deaths than we would expect based on the 5-year average. Now, some of those, probably about 3/4 of those will be because people had COVID on their death certificate, but other people's not, which is showing that the increase, unfortunately, in the number of cases is directly moving through to that. And we're also seeing an increase in the number of hospital admissions overall. So if you look at the hospitals that cover our areas, such as West Suffolk Hospital, Ipswich Hospital and James Paget, I think we were looking up, we were seeing the number of admissions over the last probably 2 or 3 weeks has more than probably tripled in that sense. So we can look at the cases and numbers; they are increasing significantly. They then lead through to increases in those hospital admissions I've just talked about, and unfortunately the increases in deaths. So yeah, there's a very clear pattern there, and this, and that's why I suppose I'm concerned and why we take this so seriously at the moment, looking at the increases that we're experiencing.